Thanks, Sarah. Hi, everybody, and welcome to the session on the Family Planning Financing Roadmap, a tool developed by HP Plus to help identify funding options for countries for family planning. This resource came about because of the evolving family planning financing landscape. We know governments have made ambitious goals and commitments, yet are struggling to raise sufficient domestic funds to meet the rising demand for family planning. This comes at a time when donor funding for family has plateaued. However, there are opportunities for more sustainable financing through new mechanisms like the Global Financing Facility or broader health reforms like introduction or expansion of health insurance, which is occurring in many countries. To secure sustainable financing, family planning stakeholders need a strong understanding of health financing concepts and how they relate to program elements and the country's health financing situation. We developed the FP Financing Roadmap as a resource for family planning stakeholders who have little prior experience in or knowledge of health financing. The website can help identify financing options for commodity security in achieving countries' family planning goals. Specifically, the website can be used to learn more about health financing concepts, explore some specific family planning financing options based on the country's context, and communicate with colleagues on best practices and lessons learned through a new community of practice feature. Here's an overview of the website structure. There are two main sections on the website, learning materials and the interactive roadmap. These two sections are linked. The learning materials include sections on different web pages that explain key health financing concepts and how they relate to family planning. It also includes a glossary of key health financing and economic terms, as well as country-specific resource pages that allow you to learn and read more about health financing and family planning publications for a specific country. Under the health financing concept subsection, there are briefs that give an overview of broad topics such as universal health coverage and the main health financing functions in a health system, but also more specific briefs on common and important topics such as health insurance, domestic resource mobilization, public financial management, and other issues. Then on the right side, we see the roadmap section of the website where you can go for more details on a particular country and narrow down to a list of relevant health financing and family planning options for a selected country. First of all, you select the country you want to focus on. The user then goes through a series of pages with data on family planning achievement and the macroeconomic, health financing, family planning financing situations of the country, and ultimately arrive at a summary brief that includes relevant family financing recommendations linked to data entered in the previous pages. So if there are changes made in the data that are entered, the brief reflects this. So let's go to the next slide. Great. So there's an underlying algorithm that categorizes countries into archetypes based on the current MCPR and health financing maturity of a country. Here's a graphical representation of the archetypes that we grouped countries into under the roadmap. We map countries represented by dots in this graph based on their MCPR and their health financing maturity level. The MCPR classification is based on the S-curve framework that guides how quickly MCPR may grow in the next few years and what investments may be needed to accommodate this growth. How we determine health financing level is a bit more complex. We evaluate countries across three dimensions: the fiscal space for health, which is the budgetary room for increasing spending on health. We also consider dependency on external funding and coverage of prepayment schemes like health insurance in the country. The reason we consider both MCPR and health financing maturity is because two countries may have the same MCPR but different health financing contexts, which means that the same financing options may not be appropriate or feasible in a country. So we see that with one of the circles here. Then in the other circle, we see that they may have the same health financing levels, but different MCPR. So the different types of investment that would be needed are different to help a country move along the S curve. The archetypes are important because they give an overarching framework to think about prioritizing recommendations. For example, improving equity in family planning use and forming a plan for transition in external funding support may be more pressing for and achievable for countries in the upper right corner of the graph. Now, let's go a little bit deeper, looking at the country represented by the red dot. The country has a growing MCPR and emergent health financing maturity level, which means the country will likely see fairly rapid growth in MCPR within the next several years and may also have some capacity to increase domestic financing for family planning programs. We anticipate many countries to be classified in this archetype, and it'll be rare to find a country with a low MCPR but a high financing maturity level, or vice versa. Broad recommendations for this country represented in the red dot include focusing on domestic resource mobilization for health and family planning in line with economic growth and ensuring that family planning is considered in any health financing reform initiatives, which are common in countries with emergent health financing maturity. Depending on the country's context, such as whether or not it has a budgetary line item for family planning already, or the different types of health insurance schemes that include family planning, the roadmap generates more specific recommendations. So let's take a quick look at the roadmap. Here we see what it looks like. Pardon me? Am I good? Okay. Across, we see home, learning materials, roadmap, community of practice, and resource library. So if we scroll down, we see, like we saw in the overview slide, learning materials on the left, the roadmap on the right. So let's take a quick look at the learning materials. There's the health financing concepts, and there's several different UHC, the basics on health financing, and then specific topics. You pick the one that you want to learn more about. There's a glossary of health financing and economic terms that help the people that this is designed for to better understand what it's all about. Remember, this is designed for people who aren't financing experts, but who need to understand the basics so that they can represent family planning programs in discussions. And then there are country resources. And these are all the countries that are included. We'll get back to that in just a second. So going back up the tree, the second side is the roadmap, and you can register so that your account information is saved and any changes you make are stored. This is a great way if you're doing this with a country team. It's a terrific tool for bringing stakeholders together to think about different scenarios, different alternatives for health financing. We're not going to register right now, but what we can do is pick a country. Let's pick Kenya, and we'll see how this is set up. We've got on this page of family planning characteristics in Kenya, we've got a lot of indicators. This column shows the default, which is shown by the data source and the year of the data. So for example, MCPR is based on track 20 data 2019 of 45%. Now you as the user can change the input. You could say, oh, since then MCPR has increased to 48%. And you can do that with all the data in here. Go on to the next page, the macroeconomic environment, different indicators related to GDP, spending in health, etc. Again, all of these have basic data sources that get updated by the project periodically, but you as the user can make any changes that you want. Health financing environment, same type of arrangement. Health reforms, what's going on in terms of essential benefit packages, national and social health insurance, etc. So you scroll down, family planning financing environment, about the reliance on domestically mobilized funding, external funding, etc. And now it's doing the thinking, and it gives us the roadmap results. So this is essentially that brief that gives us some recommendations about how to move forward. So we didn't make any changes so in applying it. So we did, what we have as the baseline and the goal remain the same. It gives a summary of the health financing situation, some of the basic statistics, what's available, a summary of the inputs that the users put in, and then it shows where the country falls on the archetype. So here we've got high MCPR, but low health financing maturity based on the inputs that are default. Some of the recommendations or the options that Kenya might consider are ensuring that family planning allocations by the government are consistent with the cost estimates in the RMNCAH investment case for the global financing facility. So really tapping into what's going on with GFF and making sure family planning is included. Public financial management, health insurance, different types of taxes. And then here is a list of resources that are available all about Kenya. So in a nutshell, that is how the health uh, family planning financing roadmap operates. It's a great tool to help novices and experienced family planning experts get familiar with financing terms for family planning.
Thanks, Jay. We have a couple of questions in the chat.
Okay.
Do you see the chat? Or do you want me to read them?
Why don't I? Well, why don't you read them?
Okay, from Marta. We have demand for FP is growing in Nigeria, but the level of commodities being provided and health financing for FP is not keeping up. The donors have handed over FP commodity procurement to the government. No funding was put into the budget. What tools can we use to help the government at federal and state levels to budget and plan better? And what are innovative ideas that we can use to ensure commodity needs are met?
So I think that the importance of what you're talking about, Marta, is first of all having a good estimate of what is needed. What this tool is designed to help think about what are the additional sources for funding. I think this can be useful based on understanding Nigeria's situation, but I think you're talking about a more specific example of getting to the point of how much funding is needed for family planning. And so that might go into some other tools. FamPlan, certainly the Impact Now gets into some of the costs associated with commodities. I think that the supply chain projects really get into estimating the costs. Once you have an idea of what the resource need is for commodities, then really getting into the advocacy approach of identifying what are the ways the different methods, and this may be useful in Nigeria because the tool gets into some of the specifics, but there's not going to be any substitute for that knowledge on the ground that you and Nigerian stakeholders will bring national level, state level. So get the data, work with stakeholders to identify options, align with the possibilities that are there, and advocate with all your heart, I think, is what it takes. No simple solutions. We know that.
Yeah. I think we have time for one more quick question. Ayan asks, was handing over an abrupt transition? Both USAID and UNFPA are currently working on a co-financing strategy for FP commodities.
That
So
was
I
Jay.
think
That was
certainly
related
the
to
UNFPA
matters.
situation is urgent because of its financing situation. Its donor, its reliance on donors and having it cut. I think USAID has been thinking about co-financing for a while. They've had their graduation strategies, and countries have graduated over time. I think it'll be really interesting to see what USAID opts to do in terms of co-financing. Results like this from the roadmap may be useful for estimating, uh, how much is needed. And like I said to Marta, this is useful for thinking about financing options, but not necessarily getting to how much is needed for family planning. So I think you're asking a big, important question. I think it's USAID's call to make about how they move forward, thinking about co-financing as donor funding plateaus. Certainly, we're at a time where increasing responsibility is being placed on countries to mobilize resources, and some of the things we talked about, GFF, et cetera, are good ways to make sure funding is increasing.
Thank you so much, Jay, for that great presentation, and thank you to the audience.